name is Kate Sardi-Schmeck, and I am the Executive Director of the Global Alliance for Rheumatic and Congenital Hearts. It is my pleasure today to introduce you to Amy Verstappen. Amy has been a patient advocate for over 25 years. Inspired by her own challenges living with a complex heart defect, she served as the president of the Adult Congenital Heart Association from 2001 to 2013. She has co-authored numerous publications and has worked with patient and professional groups around the world. Currently, she serves as the co-founder and president of Global Arch. Amy, it's wonderful to talk to you today.
Well, it's an honor to be here. Thank you.
So, Amy, to get started, can you provide a little background about Global Arch and what our mission is?
Sure. So, the mission of Global Arch is to improve lifelong worldwide outcomes in childhood onset heart disease through empowering patient and family organizations. So, we're a little different. I think we're pretty unique in this space because most organizations that work in the space either work directly with patients and families, whether it's medical care, or are not specifically focused on childhood onset heart disease. Um, and the reason we focus on those patient family organizations is essentially coming right out of my experience at the Adult Congenital Heart Association. So we know that having strong collective patient and family groups is essential. And it's essential for lots of reasons. It's essential because at the end of the day, all of us want patient family centered care, and all of us need to make sure that the care we give actually addresses the things that patient and families need the most. We also know that around the world, patients and families living with all kinds of heart disease that starts in childhood essentially need support and education. We know that people feel very lonely, and it's a journey where people empower each other, they talk to each other, they educate each other, and then often they become essential voices for change in their country. And the big example I always give for that is the HIV/AIDS groups. So many of us are very aware of how much of a difference those patient-led groups made in the history and access to care in HIV/AIDS. And if you look globally, we do have a lot of groups around the world, but there is a gap in low and middle income countries in terms of having a voice. And I would note that there's an especially a big gap in rheumatic heart disease. Right now, Global Arch has over 80 organizational members. Over 60 of those are specifically patient family led organizations. Most of them are in low and middle income countries, but predominantly they focus on CHD and or both CHD and RHD. And we really need to promote the development of patient organizations in RHD. And I think this is one of the things that Global Arch can do. Global Arch, I should just note, it's free. Any organization can join as long as the focus of their organization is exclusively or predominantly on childhood onset heart disease.
Thanks, Amy. And so, with all of our groups that we work with, could you highlight some of the examples of the works from our rheumatic heart disease focus groups?
Absolutely. So I think that the groups that the rheumatic heart disease patients lead are profoundly impactful in their community. And I will note that later in the conference, Flavia Kamalembo, who has been very involved in the patient group in Uganda, is going to be speaking. And you can talk to her about lots of examples about how they make a difference. But the first area I'm going to focus on is actually around stigma. One of the things that our groups in low and middle income countries tell us consistently is that stigma and mental health is as important as physical health, and it is a big problem. And so the people are ashamed of their heart defect or their heart condition, and that is very impactful in their lives. Families may be discriminated against if they have a heart child. People may hide their disease. And in fact, people can go to great lengths to mask the fact that they have RHD. So one example that came up, I know, talking to some of the group leaders um, in one of our communities, essentially because the group was getting together informally and talking, what they realized is many of the young women who had artificial heart valves were telling each other to stop taking their anticoagulation. And the reason for that is because they said, oh, if you stop taking your anticoagulation, it won't click anymore. So what the group did, of course, is start helping people understand you don't want that. That means your valve is got clotted, and explaining how essential it was that they not do that. And that's something that nobody knew that was happening until the group got information about that. Right. So another example would be one of the key things for a clinician is to understand where the knowledge gaps are for your patient and families that you work with. And one of the interesting things that came out, I know, in the RHD group in Uganda is through the group talking with each other and through, I know Flavia Kamalembo is here, she's a leader there. What they realized, which had been unappreciated, is many of the women living with RHD had been told you can't have children. And their perception, which they certainly hadn't told their clinician, was what that meant is they couldn't get pregnant, so they weren't using birth control. So that's just a few examples of why I think these groups are essential in terms of, informing our priorities. The final thing I'll say is that our groups can be very active in advocacy and advocating for change and access to care in their region. So some of our groups have worked very extensively on working with government, just raising awareness of what people need. Um, so those are some examples of all the amazing things that our groups do.
Thanks, Amy. And I know with the stigma and as well as, whether it's about your actual condition or also about dating, how that also plays an influence on the well-being and the physical health of the patients as well. And with that in mind, about all of the action that our organizations have taken and the patients, what are some of the barriers that they're facing in this space?
Well, I'm not going to talk a whole lot about that only because I know that Anu and Flavia are going to be talking about that extensively. So I will note all of us in this room know what the barriers are in the healthcare setting. Huge issues with, first of all, accurate diagnosis for RHD patients that even, many of them are misdiagnosed. Many of them are being seen by care community providers who do not understand how to even take, what RHD looks like. Being able to access the care they need. So can they reach it? Does it even exist? Can they pay for it? I know that some of the stories I'm sure you'll hear later on about the financial burden of living with RHD is huge. I think, again, one of the things about stigma is it often prevents people from going back to care because you don't want people to know you have your problem. Also, big problems with employment, getting disability benefits, all of those things are huge barriers and challenges that our community still struggles with all over the world. And the rheumatic heart disease community specifically really has to face.
And so, with all these barriers in mind, what are some examples or that the professional community can help partner with the patient organizations to really impact the RHD space around the world?
Well, first of all, I know that this group is really focused on end RHD. And I just want to give a shout out to what an extraordinary effort that is. It's disgraceful that RHD hasn't been eradicated. I think in high income countries, there is a huge lack of awareness of even what RHD is. And one of our goals at Global Arch is really working on that, really working on all our groups, understanding what it is and why it needs to be eradicated. And I also would say that the initial effort to get the resolution passed at the WHO was driven critically by those patient voices. And so I think that that is a huge example of the kind of win you can get working together. And all of the things I've said about mutual learning, that including patients in, for example, research priorities. So I've been in the room in South Africa where there's been very active discussions with the patients about what should the priorities be in research, and also disseminating it. There is an expression in the space, nothing about me without me, and that is essential. The other thing I just want to note in terms of helping patient family communities and the way professionals can be involved is, even as we all focus critically on ending RHD, we need to make sure that we're paying equal focus to the issues of how do we ensure that every person affected by rheumatic heart disease achieves their right to health and well-being.
Mhm.
As I just noted, there are huge issues in care access. And Global Arch is really focusing on developing advocacy efforts focused on what kind of care, what kind of policy changes do we need to really start improving worldwide access to cardiac care, especially for the young. And that's just, we know it's been at a standstill for many years, and we really need to kick that forward. I think that one of the things you saw, we recently met with the USAID and the World Bank in DC, and the team that went to those meetings included a number of the clinicians who are here at this meeting to make the argument of why this kind of care matters, why it matters to public health, and the patient leaders. And that's essential. I think more at the community level, I think the idea of connect with your groups. If you don't have a group, you can have an essential role in identifying potential leaders, letting us know about it. You can collaborate on education efforts. And the final thing I'll just highlight is these groups can really help you. They can be a extension, right? We know that nobody has enough time to educate, and that education, really understanding disease and what a family or a person needs to do, takes many, many repetitions. That's what groups can do. And, all of us are collaborating on this goal of improving lifelong health for every person living with this disease. And there's lots of ways we can partner together to make that happen.
Thank you, Amy. And thank you to the World Heart Federation, the Congress organizers, and to all of you. And a very special shout out to the Global Arch member organizations for all the work that they do around the world. I will have a call, though, really quick to shout out to our Declaration of Rights that are available on the Global Arch website, and a call to you to sign on to that. Thank you, everyone, for your time.
Thank you.